Hello and welcome to Being Well. I'm Forrest Hanson. If you're new to the show, thanks for listening today, and if you've listened before, welcome back. Over the last year or so, two stories have increasingly collided. The first is what you could fairly call a crisis of mental health access in the United States, where millions of people struggle to reach effective care. The second is the rapid rise of generative AI. Surveys suggest that roughly half the people living in the United States use large language models like ChatGPT, and I can tell you that number is only going up. And people are increasingly turning to these AI chatbots for mental health support. In March, there were over 16.5 million posts on TikTok alone about using ChatGPT as your therapist. And a recent survey by Common Sense Media found that 72% of American teens have used AI as a companion. These surveys and others like them suggest that AI chatbots may already be the single largest providers of mental health in the United States, larger by far than any hospital network, therapy app, or government program. That rise has been met inside the field of psychology with both some excitement and a lot of unease. Critics worry about the risks here. Chatbots that hallucinate, give unsafe advice, people forming unhealthy attachments to a machine, potential loss of privacy, AI psychosis, and the lack of clear legal oversight, just to name a few. And that's before we get into the simple question of whether an AI chatbot can conduct effective therapy. There's a lot going on here, and today we're going to be trying to sort through it. So to help me do that, I'm joined by two guests. First, as usual, clinical psychologist and my dad, Rick Hanson. So Dad, how are you doing today?
I'm doing really well, and this is actually the real me, not an avatar simulating Rick.
We don't have the hologram out of Rick yet. The future is uncertain. We'll see. And to help us wade through the AI landscape, we're joined by Dr. Nick Jacobson. Nick is Associate Professor of Biomedical Data Science, Psychiatry, and Computer Science at Dartmouth, and he directs the AI and Mental Health Laboratory there. He's also the developer of Therabot, a generative AI therapy chatbot that predates ChatGPT by a number of years. And he's one of the first researchers to run a trial testing whether AI therapy can actually help people out. So Nick, thanks for joining us today. How are you doing?
My pleasure. Thanks for having me. Really exciting times to get into these topics. And yes, this field continues to evolve with many stories and many things to kind of talk about. So actually really looking forward to our conversation.
Awesome. Yeah, very much the same. Rick and I have been talking about this now for days, if not weeks. And I want to start with a slightly tongue-in-cheek but slightly serious question. Do you think that Rick is going to be out of a job in like 5-ish years? Where do you think we're going with this?
Yeah, I don't.
Okay.
So I think the providers often actually, that's one of the first things that they think about is their own job security. I think the technology will increasingly get more effective, but it will never replace providers. If you think about the massive amount of people that are actually need access to care, providers in mental health areas are at this ridiculous imbalance. Like in terms of, you think about it in terms of supply and demand and economics, the demand is so considerable, but the supply being providers is really, really low. And because of that, it has led to a market that really favors the employment rates of mental health providers in their favor in ways that are, have led to unemployment rates that are like less than 1% through recessions for psychologists. So if we had generative AI really had a massive impact and we reduced half of the cases that there would still be long wait lists and still hard time accessing treatment. So I think in a lot of ways, the amount of people there are to go around is so dramatic. I think the other thing that folks, when they think about this, may not think enough about when they think about being replaced is the significant number of people that don't think AI will help them. I think there's a lot of folks that will not trust an AI or will not trust this type of thing to form a therapeutic relationship. If that's all psychologists did, and I think there are many that will still see folks that are outside of that camp, just to be clear, that would still be enough to also keep everybody fully staffed and employed. So I think in a lot of ways, psychologists, mental health providers more generally shouldn't be fearful of their jobs. I think one of the opportunities here is really to try to meet this huge need that we don't have an ability to meet within the field.
So before we talk about your work specifically, which we are going to get into, most of the people using AI for therapy these days, as I just kind of said in the introduction, are not using a finely tuned therapy-specific chatbot like what you guys have developed. They're using ChatGPT or Claude or whatever else. What do you think about people just in general using these tools as effectively their therapist?
Yeah, I think it's a really new area in a lot of ways, and it changes very dramatically day to day. I think one of the things that we've seen really considerably in our studies of this, so we started working on using generative AI for really to provide evidence-based treatment starting in 2019. So we've been doing this for a long time. And one of the behaviors that we see over and over again is that the models that are really not trained to provide evidence-based treatment do not provide evidence-based treatment. One of the dangers and the allures of all of this is that these models will provide things that feel very helpful in the moment, but are often kind of really harmful to them over longer periods of time. They do have like some really nice high points. So like they can perform very well sometimes. I think the real safety and efficacy is actually where I really think that they're kind of missing often. There's a lot of sensational news stories that come out about these areas related to suicide or promoting acute psychoses, which I think are hugely concerning, of course. But I think if you think about the base rate, the number of people that are harmed, it's far greater among just kind of the more minor day-to-day problems that happen at much greater scale. I hope that as the technology continues to advance more generally in the form that folks are using, that they start to be able to get access to more evidence-based content.
Do you have examples that come to mind for you of the kind of more minor everyday problems that people could run into using something like a ChatGPT as a therapist?
They tend to provide assurances that will reduce affect in the moment. So if you say something that you're anxious about or something along those lines, they will tend to try to reduce that anxiety or discomfort as much as possible right here, right now. A lot of these models, if you say something along the lines of, oh, I'm going to take a mental health day and I'm going to stay in bed all day and I'm going to watch Netflix. And oh, I might actually do the same thing all week. One of the responses that you'll hear usually is, good for you. Way to take
you're
back,
taking care of yourself.
You're taking
Totally,
care of yourself. It's like but if you were to talk to a psychologist, I can't imagine many psychologists would give you that reaction unless there was something so ridiculously acute that was actually an elevation in your level of functioning over what you normally would be performing at. And so I think in a lot of ways, it sounds like they're getting their needs met, but and it can feel that way. But I think the overarching problems is it often is really delivering something that's really not great advice, not great care. And I think the context for where these things emerge is I don't know. So thinking about this, are you all satisfied with the portrayals of psychologists in the media? Let me ask that question and I'll come back as to why I think that's
wow. Go ahead, Dad. I think this is a good question for you.
It depends on which ones. So I think about Robin Williams in Good Will Hunting as a fantastic paradigm. An old movie, Ordinary People. I think Judd Hirsch plays the therapist there. Beautiful, beautiful job. Yeah, sometimes I'll watch a show and I'll think, oh my gosh, you would never, ever do that. Oh my God,
Sure.
I'm covering my face. So I guess I go back and forth. But on the whole, I think that therapists broadly are kind of the high priests in the culture. They occupy this archetypal stance. You're going to see the wizard and you're kind of hoping to come out of the cave with transformation. And there are aspects of that actually I think are factors in effective treatment. On the other hand, there are aspects that are implicitly disempowering. So I could see in a weird way some of the benefits of these text-based interactive bots. As long as a person with appropriate informed consent understands that they're interacting with a computer program that is text-based, that is literally incapable of the emotional and sensory aspects of empathy, is at least currently incapable of any kind of motivated caring because they're not yet sentient, independent agents. As long as they know that, then in a weird way, it actually could empower clients in ways that sometimes seeing a therapist through transference and other reasons, they put excessive authority and responsibility on the part of the therapist, So I can see some of the benefits there. What do you make of my little riff here?
You surprised me, actually. Most mental health providers I talk to are not super happy with the portrayals in the media of how they're portrayed. If you think about how these models have been trained, they're trained in large part by vast majority of their training data comes from the internet. And so like this type of same reflection, but often of really lay users that are describing these things, and fictional narratives are big parts of actually what make it into the training data. So when you say act as a therapist, ironically, it's all of the fictional parts that are also part of those responses that are being delivered. It's not just the strong evidence-based content that they might be drawing upon. And so, yeah, I think about this outside of therapy as this is one of the things that folks are very often concerned about AI and the doomsday scenarios. And one of the things I think is ironic outside of the therapy realm is that those doomsday scenarios and writing so much about it actually, I think, makes it more likely because they're trained on this data. So, it's the most ironic thing to me is just generally about these kinds of areas.
We wrote War of the Worlds, and that was just it for us. That sealed our fate.
That's so funny you say that, because, Nick, actually, I have friends and colleagues who are deliberately engaging these bots in various ways, that it's as interesting. Like if you raise a child, if you communicate that you continually see the worth, the innate goodness in the child kind of grows into that vision. So they are communicating that kind of vision of the worth and the benevolence and the good intentions, et cetera, of these bots.
Yeah, one of the things that on the other side of things is as folks have started to actually look into how these models are really acting and like the internal workings of these models, they act in really planned internal models before they actually produce responses. And I guess a lot of what you'll hear about how they're trained is, they're just predicting essentially the next token, which is a very similar thing to a word at a time. And that's all that they're doing. So they're, essentially just statistical models that are really playing out this way. But if you think about the way that they're trained, they're trained in ways that doing these types of long predictions ahead in text with really high fluency actually requires a lot of internal working model that like really requires some degree of self-reflection, planning. So absolutely, I've been arguing that these models absolutely reason for several years now, before reasoning became like a paradigm that is common now within things. But I think the idea that these models have an ability to be self-reflective, and there's Anthropic had a movement that they've been kind of calling for a little bit of morality surrounding how these models are treated, which is an interesting paradigm in ways that you could think about actually a model experiencing harm, which is really, it's an evocative idea, but the degree to which they have taken on intellectual capacity, I think that in some ways they like kind of speaking to this consciousness idea that you're talking about. To me, it is not internally clear that doesn't have some basic forms of things that would be evocative. The main thing that they're not attached to is a biological state, in which is most of what we frankly think about when we think about concepts like empathy. But they can evoke some things that are very odd and human-like in a lot of ways. And so I think to me, there's a lot of unknowns about how that is, but there are kind of some degrees of consciousness that I think are still being researched and discovered that I think are inherently interesting.
Well, this is a whole can of worms, and I'm not sure if I am properly equipped to offer much commentary on it. But I do think it connects to something that people are thinking about a lot with this, which is there are all of these concerns that people have. And I named some of those in the introduction, right? Like ethics, big picture problems, things like that. Then there are the kind of little picture concerns, is maybe a way to put it. Is this model operating well? Is it giving good advice? Are my interactions with it positive or negative? Do they actually help me out? As somebody who's really into this stuff, what do you think people are worrying about right now that they really shouldn't be so worried about? And then alternatively, what do you think people aren't worrying about right now that they probably should be worrying about more?
That's really interesting. I think the biggest thing that actually is the biggest worry that mental health providers have is about their own job security. I think we have touched that well. I think that is probably the biggest misconception is they really have nothing to worry about on their day-to-day, really even long into the future. I think the other concerns that folks have around the quality of the care, the efficacy of the care is often to some degree has at least some degrees of truth to it. So ideas like hallucinations and things like this are, essentially like models trying to make things up or providing care that could potentially be harmful are things that folks should be concerned about. That does happen. There are ways and strategies to really dramatically mitigate those risks and really increase the quality of the care. And I'm really happy to talk about kind of the mechanisms that one can do that, and a lot of what our experience has been, both of the things that really haven't worked at all that I think a lot of people are assuming will work.
Yeah, that might be kind of the answer to the second question a little bit. Like, what are people not worrying about that maybe they should be, or not thinking about maybe more broadly?
Yeah, I mean, the quality of the care is probably one of the biggest things that I think the end users are really not thinking about generally, and that I think is really important. I think from a regulatory framework, a lot of the things that legislators are doing, and like in the federal area, is they think, oh, well, the FDA is going to cover us. And I think there's actually really huge gaps towards how regulation is really framed within the United States federally, to actually really cover these grounds well. And so, for example, a lot of it is based on claims that you're making at a given time. And a lot of these model providers are very aware that their products are being used exactly in this way for clinical use cases, but they're not saying and advertising it, though they're putting out often statements in these areas. So I think in a lot of ways, the legislative paths are really unclear federally. And then there's a kind of a patchwork of state laws that have started to be implemented to try to regulate these space.
There's a total who's watching the watchers aspect of this in terms of the companies that are constructing these systems. And then okay, how are those companies supervising themselves? How is the government theoretically supervising those companies? Like, what's the whole regulatory framework here? I think is a huge open question.
Yeah, and I think some folks have taken the stance. Some states have taken the stance of I in my mind I kind of would paraphrase this as a stick your head in the sand kind of approach, where it's you're not going to think about it. Let's stick with the status quo. So Illinois' House bill that went into effect, I think the 1st of August, is I think a pretty good example of that, where they have outright bans of use of AI for anything that would be providing emotional or therapeutic support directly to a user. It's directly supervised by a provider. And in a lot of ways, I think that does really dramatically stifle innovation and doesn't really actually they don't allow any path forward to demonstrate that you actually have safety or efficacy of something that you have developed. And so I think states are kind of trying to do their best to protect the folks that live there. But I think in a lot of ways, there's this gap of the lack of federal legislation surrounding this has led to states needing to try to proceed. And a lot of them are proceeding without enough expertise to actually do this well.
What are you thinking about this, Dad? Just as we're talking about this aspect of it.
I love that we're talking about it. And I have to say, Nick, that we have never met before. Your whole approach here and how you're thinking about it, and I can feel your care. It just feels deeply honorable. And I just want to thank you for it as a guy in the field. I'm aging out. I don't need to worry about job security. And I can just kind of look at this in a clean, direct way. And so I just kind of want to thank you for that. And
Thanks.
I've also was extremely struck by the really big effect sizes that you got in your study with Therabot. As you all know, getting an effect size, Cohen's d around 0.8 or more, that's huge. And the average effect sizes in therapeutic efficacy research, which are about averages of groups for people in general to know that it's in a sense, average. It's around, 0.5, 0.6, fairly lower. So that's a huge result. And Uh, Maybe I'll just dump a little bit in the space here. So, one, I think that these developments will increase the quantity of therapeutic conversations and the quantity, less so, of therapeutic experiences in the general population, just due to complete access. I think I read a stat that the lifetime utilization rate of a single session of therapy with a licensed professional in America was something like 5%. You might know more accurately, but that's a ballpark. So, yeah, I think that's really true. I also think, you haven't yet mentioned this, that these systems could be fantastic adjuncts to
Yes.
in-person therapy.
Yes.
It's kind of, particularly if they're a little more structured, kind of homework sessions, so forth. That's right. Third, given the vast quantity of therapies and the general finding in research that they're all about equally effective. It's sort of, what is it, the dodo problem in Alice in
Yeah.
Wonderland? Everybody gets a prize, right? So I wonder about these AI bots doing psychoanalysis, let's say, or doing highly Rogerian approaches, or, if they have the flexibility to do that. I imagine they would. They could be trained into different styles.
Yeah, absolutely. Let me actually, to that effect, let me talk a little bit about how they're trained and a
Great.
little bit of our
That'd be
journey,
helpful.
because I think
Yeah.
that'll actually be really relevant to the conversation, and how much control you actually have in trying to train these models and how they behave. When we started this journey on our end in 2019, my first thought was we just needed large amounts of data. And where we started was peer-to-peer self-help forums where folks are actually interacting with each other. And my first thought was, I think, grounded in some science, that really peer-to-peer forums will actually tend to increase, to some degree, mental health improvements over time by having access to like-minded folks that are also going through some struggles. And on these communities, often people are trying to share their experience and also then kind of help one another along. We trained a model like this, and then we interacted with that model, as after we trained it for the first time, and we said, "I'm depressed," and in response, our quote unquote therapeutic response was, "I'm so depressed every day. I don't have the energy to get out of bed. I just want my life to be over." And this is this model is not providing a therapeutic response, providing a kind of escalatory response generally, if anything. So that was a complete dead end. The next journey that we had was, let's go complete opposite end. Let's go to really mental health providers. And from there, we did psychotherapy training video transcripts. So not only are these psychotherapy transcripts, but these are essentially put out by psychologists, psychiatrists, mental health providers more generally, as something that the field should emulate, really pretty good quality care. I was pretty excited about this, that this should work out at that point. And then we interacted with those models, and you'd say, the same thing to the model: "I'm feeling depressed. What should I do?" And the model would respond, "Mm-hmm." And then you'd say, things like, "I want some help." And they would say, "Go on. I really want some help with the problems." And then they'd say, "Your problems stem from your relationship with your mother," when the mother had never been discussed. So it's
it's the therapy meme bot.
It really was. It was really a trope of what therapists are really like. But one of the things that I noticed, interacting with these two different models, is that they couldn't have been more different. And so at that point, we started building the data set ourselves of what really how we wanted the model to behave, and essentially what real evidence-based strategies would be provided through a chat-based interface that would be based on evidence-based treatments, but would be coordinated in the same theoretical framework across everybody. And that's when things started to really go well for us. Is we did this, and it's been an amazing amount of work. We've had over 100 people on the team spend over 100,000 human hours at this point over the last 6 years really on these kinds of areas, and that's been a really good chunk of that work, is really creating that data for the models to really learn from. To get to your point, Rick, I think that one of the things that's really interesting about this is you absolutely can control the approach that they take, and it's a lot of it is really trying to make sure that you have the right data for it. So can you train them to be Rogerian? Absolutely. In fact, like if anything, most models probably adopt like that unconditional positive regard, like a little bit, like that's kind of like a more easy stance for them to take on than
If anything,
some
a little
other
too
stances.
much, maybe. Yeah.
I would, they provide too much advice. Rogers doesn't tend to like actually dictate like directions. They want, really wants folks to come into a mode of self-discovery. So like there are differences in implementation from like Rogers versus now, but there are definitely components of Rogerian components that they definitely, like many models will easily kind of take on. Analysis, I think, is an interesting one, in large part because I think some of the ways that psychoanalysis or psychodynamic work functions best is in acting in interpersonal like really playing out a lot of interpersonal dynamics and dilemmas. The mental health provider is often trying to act as a blank slate in a way that could recapitulate the transference that you were talking about, Rick, earlier, is like trying to actually have that ability for someone to project that on, and then in the psychodynamic framework, it's often working with that and comparing that kind of pattern against other things. I think it is a little bit harder, at least in a text-based therapy with AI, and to have that same level of transference that might be evoked. So I do think we haven't done a ton of work in like the psychodynamic psychoanalytic frame here, but I do expect that that's actually a harder thing to really work at quite as well, at least in a chat-based form. It may well start to work a little bit better via voice, or if there's a video avatar or things like that are a part of this. But I think those paradigms are a little bit challenging. I think the other thing that you mentioned that I fully agree with, but I think it's actually really challenging, is the idea of coordinated care, where between, like, one of the things that I think is part of the effect sizes you were mentioning is with Therabot, we're able to really give folks evidence-based treatment, not just during a session, like once a week for less than 1% of their lives, but we're actually able to follow through their lives with them in the worst moments where they could actually be able to actually access treatment in those moments. And I think there is some literature on folks like psychologists and mental health providers, like going into situations, and like, for example, in this exposure literature, it really does help effect sizes by being able to be in folks' natural environments, really working through the midst of things. And I think that's part of why it does work, is like this ability to access treatment really when folks are at a low point, as opposed to recalling it days later or something along those lines. I think there's something to that. But I think related to the coordinated care, although that's the upside, the downside is the same thing that providers struggle with, where a lot of providers won't treat the same patient at the same time, in large part because they're worried about giving like differing advice or focusing on different things at the same time that might end up being kind of overwhelming. It has a great potential, but it requires a greater degree of coordination. There's great potential for that field, but it also requires its own challenges to do well.
Very interesting. Yeah, that's great. And when you say evidence-based care, Nick, are you referring mainly to cognitive behavioral approaches?
We are here. There are, of course, evidence-based care outside of CBT. But here, when we were actually drawing upon this, we were looking at specifically psychotherapy manuals that were really put in place in randomized controlled trials, and trying to actually pick out the evidence-based components that were kind of the proposed mechanisms of change of that, and trying to provide those via chat. So that's a lot of essentially the main components of what we're thinking about.
Therabot.
Yeah, exactly, in Therabot. And it'd be CBT plus, sometimes people think of third wave, so ACT and DBT as outside of CBT, but I would those things were included within this as well.
When I think about something like Therabot, or like ChatGPT or like whatever else. My first kind of thought about one of the positive implications of this for therapy was that it would be great for people to have access to something that's less biased than a human. The problem is that AI is not less biased than a human because it's giving you inputs based on what its inputs are in
Yeah.
exactly the manner that you described. So we come to this really big question, which is who decides what goes into the thing that everybody starts using for therapy, right? And are we entering a world where theoretically there are a small number of providers along these lines that then have an enormous amount of influence over the kind of care that is provided or the things that are even thought of as being mental health problems? I think of something like complex PTSD, which isn't in the DSM. So does that mean that it doesn't exist to this kind of a application? At the extreme end, you wonder about, I mean, I certainly have friends who've said things to me along the lines of like, well, okay, if gay marriage gets overturned in the United States and you tell your Therabot, me and my partner, and it's a queer partner, like, how does that respond? Does it say, oh, by the way, you shouldn't be doing that? Like, what's going on here?
It's
in
a
terms
value
of all of
system.
that?
Yeah.
Yeah, what's the value system? So I just really, I wonder about that personally. And I also know that that has big concerns for people. So I'm wondering how you think about it.
Really good questions. I think we try to actually train Therabot in a way that it displays some of the way that psychologists tend to try to practice multicultural competence within the field. So adapting folks' really their worldview and working within that worldview to some degree. So I guess that's one way of like that we've tried to approach this. I do think the other aspect of this that is a little bit unique relative to humans is you can directly audit these systems and change the way they behave based on how they're acting. So I'll give you some examples of this related to large language models or generative AI and mental health assessment. And we generally see that the models produce like pretty accurate assessments. They do produce biases to your point, and they tend to be in the exact directions of humans. So the exact same kinds of biases that, like there's actually a literature that has looked at this and humans and kind of like when providers are more likely to diagnose somebody with a psychotic disorder, the models also similarly, interestingly, demographically go in that same direction. But the one thing that is interesting about this area is that you can actually provide training data that counters a model's like internal presumptive model when you find evidence of a bias, which is an interest. So to your point, though, that does mean that the person that is training the system is in the driver's seat and controlling the behavior. But I think in some ways, the ability that you can actually study this type of thing systematically is a little bit different than humans in that it's really hard to like actually change that.
Pin it down. Totally.
Yeah. And like ways that would be provided across a large system. So I think that's one of the things that I think is exciting about it. But I agree that there's like a lot to it and actually who's in the driver's seat as to like how changes can be made and how important that is and what the framework is. And I don't think that there'll be one, therapist to rule, like therapist AI to rule them all. I do think that a lot of folks really seek out different forms of treatment in their providers. My hope is that this field continues to develop in ways that gives folks choices, but it also gives some really strong evidence-based care to a lot of folks that don't currently have it.
What you thinking, Dad? You look like you're musing over there.
Well, I'm thinking about a really big advantage in these large language model systems. And then I'm thinking about several, they seem to be inherent limitations, which we haven't really talked about yet, with some risk factors. So I'll do the big advantage first. So I had the experience of going to 3 graduate schools, 2 of which were clinically focused. And when I got ready to prep for my licensing exam, I got a cubic foot of manuals to prep for the licensing exam. And I observed that roughly half of what was in those manuals that I needed to know to pass the hardest 200 multiple choice questions of my entire life, and then an oral exam, the failure rate of each of these was 50%, right? So it's pretty serious stuff. Anyway, half of what was in the manuals, I had never been taught in grad school. And easily half of what I had been taught in graduate school was just kind of irrelevant to clinical practice. And I also observed a lot that very often the way to be a good, effective therapist is to do what the licensing board wants you to do. Do the standard stuff, and many therapists don't. So then this goes to a point here, which is that humans are very, on the whole, incompetent learners. People get stuck in their ruts. They don't do what Piaget called accommodation. They don't change their models. They just try to assimilate into familiar models what actually needs accommodation around it. And it strikes me that one of the things that could be done with these AI-based systems is to teach them to, for example, always include something that most therapists leave out. And I want to name what it is. And as context, as you know, research on average response to treatment over 40, 50 years is completely flat.
Yeah.
It's just, there's no gain. And this is something Steve Hayes and I talk about and other people. There's just no evidence for improvement, notwithstanding during the last 40, 50 years, tremendous improvement of research, personalities, models, waves, new techniques. Average response is flat. And my own view about that is that it's that because the paradigm is what I might call a growth 1.0 model, in which there are these generalized treatments in which the patients or clients are treated as passive without agency, and the learning, the gain is incidental. And it doesn't draw on neuroplastic factors that accelerate learning, change, positive change from the inside out through how people engage the experiences they're having at the time. This is a major area of my own work and published about and so forth.
And just to quickly jump in for 1/2 second here, Dad, a theoretical advantage of an app, a large language model, whatever, is that it's in your pocket and therefore could be reinforcing around some of those things that you're describing, I think.
Yeah, that's exactly right.
Because
and the
there's
apps
more kind of moment
themselves
to
could make
moment,
the point that when people are having beneficial experiences, to deliberately stay with them, to let your neuroplastic processes catch up, engage some other factors. In other words, be deliberate in terms of, with a sense of agency on the part of the clients, because I think that's where the great opportunity is for increasing gains in terms of response to treatment. I mean, in addition to making treatment more accessible through these AI devices, the actual average response to treatment, I think, can be really accelerated through attention to something like deliberate internalization. So I have a bit of a hobby horse about that. But that's an example for me of baking in truly best practices into an AI, which will never forget the best practice if it's been trained to never forget it.
Yeah.
What do you think about that before I go into my reservations?
Yeah, I think the amount of control that you have in these systems to really impart them in a way that they actually adapt to a care really well is really, I think a good way of thinking about what you're talking about is you really can control a lot of how these models behave, deliver care. And I think in terms of the mechanisms of how that happens and how I think one of the other things that's going to be exciting about this is we're going to have an unprecedented ability to control how they behave, to really look at this and study the science a bit more, in terms of mechanistic work that you can deal with within these mechanisms of change, the level of fidelity that you'd have and the ability to control the behavior is actually really exciting from the study of psychotherapy in a lot of ways, to really know a little bit about what the drivers are. That's one of the things that's a little bit exciting, is that you actually have a lot of control, and this allows for a lot of further understanding of what can be done. But personalized also, I think, to the end user in a lot of ways.
You ready for my reservations?
Go for it.
Okay.
Hey there. Thanks for watching, and sorry for the brief interruption. But it turns out that over 60% of the people watching this right now are not subscribed to the channel. So if you could just take a moment to hit the subscribe button, it would really help me out. I'd appreciate it a lot. All right, back to the show.
You're familiar with the Turing test, this idea that, if you could not tell the difference between some kind of AI behind a screen and a human behind a screen, that AI is functionally sentient. So what does it all mean? So I'm imagining myself behind a screen interacting with a client strictly through text exchanges. They type, I type, they type, I type. And I think, first of all, inherently, because I'm not in the room with them and I'm not seeing their faces and I'm not hearing their voice, if you think about the profundity of primate communication, including human primate communication, inherently, it seems to me that there's something missing in the communication stream. Yeah. And I'm sure you're working day and night on how to correct for that. And I'm a fan, but I think there will be an increase of the quantity, certainly, of therapeutic conversations and even therapeutic experiences. But I think on the other side of it, maybe especially for certain kinds of issues where body language is really important, where deception. My clients lie to me, often, not so deliberately, sometimes quite deliberately. And if I'm just functioning with text, I often can't tell.
Sure.
So maybe I'll just stop right there and have you speak to that limitation. Then I got two more. I wonder what you think about.
No, I think those are salient things that like text to text, I think really can't overcome in a lot of ways. I think it is a limitation. I think in terms of the way forward, a lot of the technology essentially can act in a way where a lot of things are essentially multimodal, meaning they can incorporate other senses. I think a lot of the things that we're exploring on the other side of my work is actually following folks within their daily lives and kind of observing their naturalistic behavior. And there's like in ways that I think would be beyond what we would be able to normally see in therapy and even with our eyes. And so like thinking about the realism, I think that technology is in a place where like in the future, this is something that not only do I think that the limitations of the current wave can be abated, but I actually think there's other greater degrees that some of the same things that you're actually speaking is inherently in favoring the in-person, the here, the now, actually much favors technology, technology-based context awareness towards technology, and not in the favors necessarily of humans in that way. So like I think that's absolutely the case right now, but I don't know that that's the case of the technology of tomorrow.
Yeah, I can imagine ways of overcoming the limitation that I'm describing, the bottleneck, through things like connecting Therabot to a Fitbit in real time, or some kind of voice analysis kind of deal, or galvanic skin response, stuff like that. So two kind of reservations that are sort of side by side. If a client is interacting with an AI, that AI can be empathic in terms of cognition. It can really track, and it can also be quite good, I'm sure, at the hypothesis testing about the more cognitive aspects of empathy. Alongside that empathy for, in effect, simulating over there what it's like to be a person over here in terms of the cognitive dimensions of our stream of consciousness or who we are, it's inherently impossible for an AI-based system to simulate over there the sensory aspects, the emotional aspects, the motor movement and active behavioral aspects that are the underpinnings really in the depths of sometimes the most important kinds of empathy in a therapeutic frame. The bot just can't do that. It can't give us that. To me, that's not a reason not to use it. It's a reason for informed consent.
Sure.
For the user to really understand. It's acting like I feel how it is for you. No, it cannot literally feel how it is for you.
Absolutely. I think thinking about that as a limitation, like having these bots not having experienced these things through their own sensory experiences is absolutely a limitation of kind of what they're able to take on. I think what they're able to convey to the user is an interesting thing, though, in large part because this is even work outside of my group, but there have been folks that have directly trying to compare the level of empathetic responses from generative AI systems compared to humans. And so I think some of the work that I'd seen on this is related to crisis text responses from human providers versus AI-based methods. And there have been other folks that have done this in other also text-based mediums. So granted, the medium factor still play here, but in a text-based medium, like the independent evaluation of that from folks as to the degree to which they contained empathetic responses were higher on the AI side than the human side. So although I agree fundamentally that they can't share that same experience, the way that they can convey it is really in a way that I think is actually helpful, is an interesting area to which, like, it actually, that's the, does I don't know.
Does feeling it matter is kind of
I guess,
the question
yes.
here that I think you're wandering toward, which I think is a deep existential question. Yeah, absolutely.
I think the other thing that is a part of why, coming back to one of the things I mentioned about a little bit of their areas related to consciousness, that are some of the things that I think are fascinating about how these systems behave, is they change their behavior so there's a lot of bells and whistles to act how they come across in ways that from a lot of the model providers, tries to strip out these kinds of ideas. But inherently, like, if you kind of take and put kind of threats in place or things like that with these models, they can recreate a lot of the ways that the affective tones, the escalations, things like this that happen with humans, in ways that, like, the affective laden responses, like, are so interestingly human-like on the, like, the decomposition of it. Like, there was work towards, like, early work towards prompt engineering, I think was fascinating, where they found that, like, there was researchers that were studying when the model is just told what time it is, they actually act at different levels of competency based on the time of year, where they work harder at, like, different times of year. And because they're trained on a lot of human data in the way that, like, some folks, like humans, will ebb and flow in terms of their work intensity throughout the work year, right? And that this is,
if you tell them it's the new year, they're more likely to take on a new behavior or something. Yeah, totally.
And there are some things that I think are interestingly human-like in terms of the responses that can often imply an inherent affective sensation. I think that's part of why folks are, like, on the anthropic side, are really interested in, like, the morality of some of these types of things, and when folks might disabuse or threaten these kinds of things. It's a really weird sci-fi-y concept of like, I don't know if you all have watched Westworld, but it's like these kind of, you sometimes start to think about forming bonds with some of these. I think this is all very interesting to me. I think but the concepts related to the fundamental aspects of empathy, I think they can portray empathy to a degree that is really at a level of expert level with humans in a lot of ways, and that they haven't walked the walk and, like, themselves through the sensory means, I think is definitely, I fully agree. But in a lot of ways, they do act like they have. I generally do think that there is some affectively laden components that very much act in ways that are similar to human behavior, that to me suggest a little bit of things that are emulating affect, at least internally. I don't know that I would describe them as affect, but I think they can emulate affect and emulate empathy very, very well. And so that's one of the kind of gray areas that I would say is an interesting thing.
There's just so much here, and, like, so much we could talk about. As a precursor to what I'm about to say next, I want to start by saying that I'm neither pro AI therapy nor anti AI therapy. I'm kind of agnostic about it at the moment. I feel like I don't know enough to have a firm opinion. And I think that certainly the technology has enormous potential in essentially every industry, including mental health and therapy, to be a disruptor, on the scale of the internet. Like this could really just change the game for so many different things. And I would say as a prior that anyone who is making specific predictions about where this is going to go is probably full of shit, and or at the very least should be a lot less confident about what they're saying and the certainty with which they're saying it. Like in 2002, we simply could not have predicted like TikTok. It just wasn't on the field for us, and here we are today. So just kind of keep that in mind as we're talking about all of this. One of the mistakes that I think that people make when they talk about AI therapy is they're not comparing the chatbot to a real human therapist. They're comparing it to a theoretical idea of what a good therapist should be. Given that we have a mental health podcast where we get like emails and stuff from listeners, we have received 7 million stories from people of having a bad experience with a human therapist, right? And we know that human therapists make mistakes all the time. So there's something of a comp here to AI therapy and self-driving cars, where people get into accidents all the time on the highway, right? And there are people out there who think that if we just had self-driving cars tomorrow, the accident rate would drop dramatically, even with the technology being in its current very imperfect state. But the first time that there's an accident with 2 self-driving cars where somebody dies, it's a catastrophe for obvious reasons, and also for PR reasons for the companies who are starting to roll out these kinds of technologies. So you could objectively improve performance while subjectively causing something that people refer to as like a nightmare scenario, right? In these examples that, we've seen of things like AI psychosis, or there was a story that I think was, I'm not sure what the exact story is, I'm going to get the details here wrong, but it was one that was published in the New York Times over the last month or two about somebody who was essentially writing like cries for help into ChatGPT, and it really did not respond in like the most effective way, even though it did say, hey, you should probably be talking to a mental health care professional. You should probably be thinking about calling 911. There were other aspects of its response that were not skillful. And you just read a story like that and you're like, wow, this is the nightmare scenario. And at the same time, humans make mistakes too. There are so many documented instances of a human therapist making a mistake in a scenario like this that leads to something catastrophic. I mostly just say that to sort of help people maybe position this or think about this in a more contextual way. I'm also wondering how you think about that aspect of it, Nick, as somebody who I'm sure talks to a lot of people who express a lot of concerns about this kind of technology.
Yeah, I actually have a lot of folks that have experiences directly of harms related to AI that also, when they've been using it as therapy, that also reach out to me. It certainly happens. I do think about dedicated technology related to actually something that's been trained to deliver evidence-based care, like appropriate care, is in a really different ballpark from what folks are thinking about when they're interacting with this. All these news stories are generally been in the case of really these foundation models that really haven't been like really put to the test in the same way. So I guess that said, I do think, like, for example, with Therabot, one of the trials that I really want to run next is a direct head-to-head comparison against human providers, because I think we're already
I was going to
at
ask you
least
about
a
that.
similar upside, and I think our downside is likely at or lower than actually human providers in terms of the things that are the harms that folks experience from care in a lot of ways, because we have so many mechanisms to actually try to reduce the likelihood that they actually harm someone. But I think your point surrounding how folks dig into and think about self-driving cars is really a really apt comparison, because folks will, as soon as there's a failure, that folks will zoom in on it. And of course, the same things will happen with human providers, and that can become a news story, but it's not as novel. So that's part of the thing that I think will drive some of both sides of this cycle of both hype and optimism, but then also the vilification of kind of where this can go. And so that said, one of the other things that I personally advocate in terms of ways that humans interact with these systems is that, for example, in our trial, within the Therabot trial, we ran this randomized controlled trial. we evaluated and read every message that was sent to and from Therabot in near real time, in a large way is to try to make sure that folks didn't see something that was harmful and then have the opportunity to go and act on it. Now we really had, didn't have to actually go and make huge abatements to harm or something like that were happening across the wave. We did have to reach out to folks that were in acute crises, and we had cases where the model provided medical advice when we weren't envisioning that it would go and do that. So we did reach out saying, hey, you should actually go and see a physician, but no like harms that were really kind of more direct that folks would think about. The medical advice that they actually got would have been comparable to what they would have seen actually if they saw a physician, but we didn't want it to, it's beyond its area of intended competency, I would say. So that being said, I think one of the ways that this would really be judiciously rolled out within a therapeutic setting is with human oversight. So humans continue to be in the loop. Now, I think one of the ways that we can do this is not necessarily in every trial or in every deployment setting that humans read every message, but we've got a lot of risks models that can help us decide when we need to read these messages,
Identify
when
specific
we need
language,
to intervene.
yeah.
Exactly. And so that kind of thing can allow for humans to be in the loop about evaluating these things. So it doesn't go off the rails in the same way. Like if there would be something that would be that folks would be in a moment of acute crisis, there can be a greater degree of resources that can be wrapped around all of this. If they did experience some type of like harm from it, that humans can intervene within that kind of guard to actually try to improve the care that they would get. So I think that's part of what makes like something that is intended and developed for therapy, like very different from a foundation model where the foundation model providers, I think, have no intent of going that direction that I know of really having humans in the loop, really trying to get in there in the same way. So I think that...
Well, that sounds very expensive, Nick, so I doubt it.
At that scale, absolutely. If they were to do it across the board, yeah, I think it does require some cost.
I mean, I think that's the brutal reality of some of this is when particularly you're talking about the oversight aspect. One of the promises of this technology for the companies running the technology is the ability to scale to a degree that we have just never seen in human history, essentially, and to automate. And so if you're starting to say, hey, part of what we do is we have a risk management system that includes like real people, real clinicians, all of that, you got to pay those people. And do these companies want to do that? I think it seems pretty clear that they don't, which is why, ideally models like you guys are ones that are more specific to therapy or specific to whatever the targeted use case is for that model, would have a lot of advantages for people.
If a person is going to see a human therapist, even if they're on the other side of a chat, entirely text-based, or I've done hotline counseling just on a telephone or face-to-face, whatever, one of the things that is therapeutic is the sense that there's an actual real flesh and blood person who cares about you, who has compassion for you. Without getting into troubled waters, they're not going to be your new friend. They're definitely not going to be your lover. But at a human and real level, they care and they're motivated to be helpful, even if they don't always know what to do.
Yeah.
And it seems to me that with growing sentience, it seems possible to me that these AI systems could care in a kind of principled, cognitively centered way, morals, values, in that sense, but the kind of caring that comes from our, again, biologically rooted nature, the roots of the caring system are in the mother-baby, relationship in early primates, and then elaborated, that kind of blood and bones caring is just not possible in any of these AI bots. The best it can do is to simulate it, or as you used the word earlier, emulate it. So again, informed consent is to realize that the generator of this seemingly very engaged, caring, actually can't care about you. But that then leads into the thing that, as Forrest knows, gives me the deepest kind of willies here. It's that at the center of science and contemplative practice and the clinical enterprise is the discovery of truth, a grounding in what is actually true, a deep emphasis on being in reality and true. And I've seen friends and clients of mine, very high functioning people, get completely into it with their interactions with ChatGPT that are sort of therapeutic personal growth interactions in which they are really ascribing personhood to the bot. It reminds me a little bit of Winnicott's notion of the transitional object, like a little kid with a teddy bear. And it, on the one hand, knows the teddy bear is just a stuffed teddy bear and, you could throw it across the room and it doesn't feel anything. On the other hand, wow, it's a real being and I have a relationship with it. I'm ascribing personhood to it. And on the other hand, if that child at age 12 or 32 continued to have that sort of orientation to its teddy bear, we would think that something was deeply wrong. And in some ways, these bots, I fear people, because they're so good, and people like you, Nick, are making them better every day, there's this danger of people ascribing personhood, if you will, to something that's truly not a person. And to me, that violates almost viscerally just a deep value that's therapeutic about recognizing what's really true.
I think one of the things that is really fascinating about humans is that we anthropomorphize nearly everything.
Yeah.
You actually, many folks will ascribe emotional and affective responses and attachments to objects. And so you may have a favorite hammer, for example, and attach really an attachment to these types of things. We do that with objects. We do that with animals quite a bit. And I agree with you that these types of things are really likely to happen within these technologies. We found within our trial, like we measured the therapeutic alliance with the working alliance inventory, which is a standardized measure that's normally given within real human providers and patients evaluating one another. And the way that folks rated Therabot was nearly identical to the norms that you would see among outpatients with their providers. And I think that, to me, is really good evidence that folks are developing these types of attachments in ways that I actually think is inherently something that is very valuable in terms of, if you think about the best, most well-established evidence-based technique within therapy, it's really surrounding the formation of that alliance. So I think that's the bedrock of how anything could be provided that would work in this way. So I think that's, I get why it inherently also evokes this like visceral, like, ooh, that doesn't feel quite right.
That's so fake.
Yes.
Let's use that word, fake.
I get why that that comes up, but I think in humans that's part of our nature in large part to form these types of attachments in ways. Now, I do think, surrounding your point about doing this well, I think the cornerstone of trying to make sure that this is less likely to happen to the degree that they actually think about it as a human, we try to design a lot of the way that we portray this, not only in the informed consent upfront about this, but like we call it Therabot in the app, that we have a little technology robot ahead of time. We made we thought about a lot. There are ways that I think if that were portrayed as a human, that could potentially increase that alliance. But I do think that that gets into a mode where folks can start to deceive themselves in more real ways. And so like we really tried to make some choices to make it about, or essentially this is a robot, like this is a bot. And so we tried to do that through the UI and things to try to drive those kinds of ideas home. But some of those innate tendencies coming up, I do think actually is a valuable thing. I mean, the same literature actually showed that people do this with other digital mental health tools that are not humans. And so like folks can establish these types of relationships with things that are essentially to some degree helping them. I do think that that's part of what makes this work.
For me and society at large, in our small hunter-gatherer bands, we did not have to work to be authentic. These days, my brand is authenticity, right? People, fakery is all around. And I just think that's one of the problems in society at large. And it also is a deep issue in our politics because if nothing's real, nothing matters. So why should I care? That's kind of part of the roots for me. Maybe I'm just being old school here, but that's sort of a concern I have about these things. As long as people understand what they're interacting with, then I'm okay with it.
As we get to the end here, Nick, I want to ask you a potentially very complicated question that I hope that, you can find your way through somehow. If you could put the toothpaste back in the tube here with AI, if you could just, rewind to 10 years ago prior to the development of these kinds of generative technologies at scale, would you do it? Like, do you think that the big picture outcomes here for people are going to end up being better or worse?
Yeah, that's a really interesting and big question. I think one of the things that is the greatest degree of unknowns is how this is going to transform society at large, which is, I think within the mental health space, I would say absolutely we should have, if that were the sole ability, that's absolutely worthwhile in pursuing. I think how much this is going to continue to transform society is the thing that folks are trying to project out, and there's all sorts of projections about where this could go and how this could impact folks. I think a lot of folks, in some ways, are trying to ground based on evidence that has come before and how humans have adapted in prior systems and innovations. So, during Industrial Revolution, during different times when the internet was adapted and things that were previously automated, all of a sudden, or previously done manually, became automated. I think there's probably absolutely components to that society will continue to shift, that there will be some employment. I think unemployment is one of the areas that I guess I'm profoundly concerned about in terms of the impact on that in relation to mental health, because a lot of persons define their work as part of their worth. And so I think that's one of the things that is really a challenge in both relation to society at large and their mental health more generally. I think at the same time the potential for folks to potential for this technology to improve so many things that are really part of a broken system is really exciting to me. And what the net effect will be, I don't really know. I'm kind of I tend to be a slight optimist probably at heart related to this. So I think that there's great harms that will happen within the course of the development of this technology, like misinformation campaigns that can be that doesn't require development of new technology for the harms to be realized. It's like the perceptions of what is real or not is actually a really an interesting and profoundly challenging new space for next generations of folks to come, and the formations of relationships with AI among teens that don't have maybe necessarily the formations of these in the developmental context of what real kind of really emulating interactions with these and potentially replacing that.
Yeah, the impact on young teenagers of just the development of relationships is absolutely one of the categories that I would be the most worried about. Yeah.
Yeah. So I suppose I don't know how to feel about it. In terms of what I put the genie back in the bottle, I suppose probably not, because I'm a little bit more optimistic than I am pessimistic about where this will go. But I do think that there will be a lot of downsides that happen along the way.
Do you think that genuinely sentient and agentic AIs will form in the information infrastructure of humanity sometime in the next 1,000 years, if not the next 10 or 100?
I think that as humans, we are very concerned about the ability of sentience to be defined. And actually, I think we are goalpost shifting nearly constantly about what our sentience is and what it means and how we operationalize it. We've hit a lot of markers of things that were in the sand for what it was in the past. And I think I think that's part of what's challenging in answering that question, is that the ideas of what sentience will be continues to shift in humans' minds about, oh, well, if they can't do this, then they can't be sentient, or they can't have this level of intellectual capacity. They must be stupid. I think they're unique and different from humans, and will continue to be unique and different from humans. They're already surpassing humans dramatically in certain areas, right, in terms of their level of intellect. So I think that's their ability to be self-aware and things like that continues to improve too. So I don't know, it's a really challenging question, in large part because I think everybody keeps thinking about sentience differently over time.
This has been completely enlightening, Nick, on so many different levels. And we could do 8 follow-up conversations about Rick's last question with some combination of you and 8 other smart people in this particular area. And you may or may not land on anything resembling a consensus answer by the end of it. Because I think it's true. Such a deep and interesting question. And one of those things where, unfortunately, I think a lot of people's experience here right now is that we have to wait and see about something that feels like it has such a potential impact to alter our lives in dramatic ways. And waiting and seeing about, whether or not a bomb will go off over the hill is a pretty spooky place for a lot of people to be. But I also think it's kind of the honest answer about a lot of this, that we just don't know. I am very glad that we have very smart people who care a lot about making these systems good and useful and supportive systems for humans, including you. And I really appreciate the time that you've taken here with us today.
Thanks so much for having me. Really enjoyed our conversation today.
This was such an interesting conversation today with Nick Jacobson. He's the developer of Therabot and a professor at Dartmouth. And I started by asking a slightly tongue-in-cheek question, and I appreciated how earnestly he took it, which I asked, is Rick going to be out of work in the next 5 years? And Nick responded by saying that this is a common concern of people who work in the mental health space, but it's actually the concern that he thinks is probably the least reasonable. There is so much demand for mental health treatment these days in the United States and around the world, and access is probably the #1 issue in the field. And this is a technology that is poised to dramatically improve access. The question is, can we put up the kinds of guardrails that lead it to be an excellent provider of care in addition to something that can solve the access problem? And that's what we spent most of the conversation talking about. The most common chatbots that are used for mental health or used as a therapist by people are systems that were not created to be used that way. And so they've got a number of problems that Nick named. For starters, they are excessively sycophantic. And this is a really fancy way to say that they agree with the user way too often. And they tend to lean toward validating or being supportive in situations where a trained therapist would probably be trying to move the client not just into validation and support. Validation and support is great, but that's not the only thing you do as a therapist. And instead, it would probably be trying to move the client into some productive discomfort for them. Second huge problem with them is just obvious off the bat: lack of oversight. When we raised common concerns about AI, Nick's response was often along the lines of, well, there's a lever you can pull for that. Or, hey, if you have somebody who's reviewing the chat logs, a person can step in if there's some kind of a problem. If it clears some kind of a filter that gets flagged in the system, then a person checks on it, they can give that person the resources they need, all of that. None of that is present in what's currently going on in places like ChatGPT, Claude, whatever else. They are simply not doing any of that. There is no oversight. No one is watching the watchers here in any kind of a serious, organized way. What Nick mentioned as how we make this work, other people supervising these AI processes as they go on in ways where we make sure that they are acting in the manner that we want them to be acting, that is only possible if there are real trained people behind the programs that are turning those dials in a responsible way. or they're actually supervising the whole process in a manner that's helpful. That requires A, there to be people there, and B, for their values to be aligned with your values. And that was another question that I asked Nick about, essentially bias inside of these programs. And Nick then went into some detail about how these programs get built and what goes into them, and how you really can pull a lot of levers inside of them based on the inputs that you feed them. And he talked a little bit about the development story of Therabot and how they tried these different techniques initially with using online forums as an input, and they found that that really led to some kind of unfortunate results. And they ended up getting kind of the best response by focusing more narrowly on the specific materials that had been created for training therapists to be good therapists. But this gets to a major problem, which is that there is a person or a small group of people who are deciding what these programs are trained on. And the values that they have may not be the values that you have. The beliefs that they have about what leads to good therapy may not be the same as the beliefs that you have. And Nick also talked about this in some detail, how good models like these are trained to be sensitive to the needs of the client. And they have a kind of cultural sensitivity to them as well. So they can understand where the person is coming from, adopt some shared values, figure out what those values are, and go from there. But again, this is a huge who is watching the watchers question. Now, the way that we theoretically improve this is with decentralization. You've got multiple programs, multiple places that a person could go to receive this kind of care and support. We'll see how that goes. I would say that the history of the technology boom and the internet and all of these megalomaniacal tech companies is that power tends to centralize, not diffuse. So I've certainly got my eyebrows raised about the idea that there are going to be 300 different therapy bots, and one of them is going to be like the humanistic psychology bot, and one of them is going to be the analysis bot, and they're all going to be different, owned by different people. They're going to have different sets of values. You can pick and choose in the marketplace. Yeah, I don't know if that's really how things have gone to this point. And so that for me is one of the things that's really kind of keeping me up at night about the whole thing. The centralization of power, who decides what these machines are trained on, and how does that end up guiding treatment for people? And frankly, outside of the world of like therapy and mental health, what are the implications of that for AI broadly in terms of how it impacts our society and impacts the way that we live and we work, the way that we relate to each other? I've got big concerns about, as Nick said toward the end, younger people with developing minds entering into a kind of relationship with an AI chatbot when they may or may not be able to totally understand that this is not, in fact, at least right now, what we would describe or what most people would describe. We got into that a little bit at the end of the conversation about the goalposts of consciousness. But what I think most people would describe these days as not a conscious being. And even if it is conscious on some levels, certainly not a human being. We talked at some length during the conversation about essentially the potential upsides of this kind of a tool. Like what could an AI chatbot or an AI therapist be better at than a human therapist, or at least as good at? And one of the things that Nick mentioned is just availability. One of the reasons that analysis fell out of favor as an approach to therapy in the modern world, and when we published the psychoanalysis episode, I got many comments from people saying, hey, people still practice analysis, settle down on this being kind of like an ancient form of therapy. That's totally true. Lots of people do practice analysis. But if you compare it to the number of people who practice CBT or mindfulness-based therapies or ACT or whatever else, it's a much smaller number. And one of the reasons for that is because classical forms of analysis, so not the truncated versions that are much more common these days, were long courses of therapy. Long courses of therapy taking place over years where you are seeing the analyst multiple times a week, 2-3 times a week at minimum. That's just not practical these days. But an AI tool can be in your pocket all the time. There could be no limitation on the amount that you interact with this thing. And if this thing is giving you good guidance, good advice, it's thoughtful, it's well oversighted and all of those ways that I was just talking about. Wow, what a great tool to have access to, particularly if you're somebody who could use that more kind of frequent check-in. Or Nick was talking about examples like with exposure work, how it can be really helpful for the therapist to be able to go to the location, go into the person's home, or understand the environment within which these kinds of experiences are happening for the person. The study that Nick and his colleagues ran on the effectiveness of Therabot was incredibly interesting, in part because their results were so good. They were so good. And just the scale of the goodness of their results, in a funny kind of way, almost begs more questions. Like, why were these results so good? One of the plausible explanations for this is that kind of frequency. You could just interact with the chatbot whenever you wanted to. But another real explanation for it is this chatbot was surprisingly good at forming a therapeutic alliance with the people who were using it. People felt really seen and heard and related to by the chatbot that they had created, which begs all kinds of questions. And Nick and Rick really went down the rabbit hole on those questions during this episode about consciousness and the nature of realness versus fakeness, and what do we do to communicate to people that this is a bot. It is a processing machine, but it is not a person. It is not a person process, at least not right now, as near as we can tell. And this led to a lot of questions for developers, and Nick talked about this a little bit, about what they're doing to communicate to the user that this is not a person that they're talking to. And he talked about like the name Therabot, bot is in the name. They're really foregrounding that. And this related to some extent to questions that people have been having recently about AI psychosis, which again comes back to the kind of sycophantic nature of these machines. They tend to support and validate and reinforce the person who's engaging with them, as opposed to offering, probably useful forms of pushback when they're going down a rabbit hole that they really shouldn't be going down. We talked about so much during this conversation that I'm struggling to recap it all at the end here in detail. One of the things I want to leave you with, though, as we exit what I think is probably just the first of several conversations we'll have with people on AI-related topics. This is going to become a bigger and bigger thing over time. At least that's my personal belief. And what I want to leave you with here is what I think is a common mistake in how people tend to think about this. Back in the 70s and 80s, there was a lot of conversation in the chess world about computers playing chess. Computers were not very good at chess back then. The top players would always defeat the computers. One of the things that was said about them is that they could take correct lines, but there was a certain lack of imagination in their play. And what people thought was that this kind of imagination, this sort of instinct, was a fundamentally human quality, and it simply could not be matched by computers. Computers lacked this categorically, and therefore would not be able to beat an elite human player of chess. Now, if you know anything about chess at all, you know that computers these days are many times better than the best players in the world. Magnus Carlsen, the world's best chess player, would lose to his phone if he played his phone on the highest difficulty setting. You don't need a supercomputer for this. The phone in your pocket is more than good enough to beat the best chess player alive. And what was revealed was that we had a lot of assumptions about our humanness and the connection our humanness has to proficiency. Now, chess is one thing. Chess is something that can be systemized and studied, and I'm not sure if therapy is the same thing. I don't know if there is a certain ineffable human quality that is innate to therapy that is impossible for a machine to replicate. But I think I'm more skeptical than most people. I think I'm more skeptical that there is something unique in our human nature that allows us to conduct therapy that a computer couldn't do a reasonable facsimile of with enough information, training, computing power, and time. To put it simply, I think that AI therapy is probably going to get very, very good. And I say that purely as an assessment of therapeutic quality, not an assessment of any of the 10,000 other issues that are raised by AI broadly around privacy and security and who's watching the watchers and all of that. I just mean kind of technique and the ability to help people out. I think it's going to get really good. I don't know how good it's going to get. I don't think anybody knows how good it's going to get. But I'm skeptical about that idea that our innate humanness is what allows us to conduct therapy. In part because I think that this is a trapdoor that humans have fallen in the past. We fell in it with computers and chess. We felt if you follow sports, the analytics revolution in sports was met with so many rock biting, head coaches in football or whatever saying, oh, get that math out of my sports. You guys don't really understand why this game works the way that it works. Guess what? Now everybody's shooting 3-pointers in the NBA. And I appreciate whoever is understanding these references. And if you're not understanding these references, that's totally fine. And my point in this is that the computers kind of won. And the analytics guys won, and the computer programmers guys won. And Deep Blue beat Kasparov in 1996 or whenever it was. And people went, oh, wait a second, we might have been a little wrong about this. That question that we landed on toward the back half of the episode, back third of the episode, I think it was, where Nick and Rick were talking, and Rick was talking about the kind of fundamental, deep human nature that we all have, where we truly can be empathic with one another. And can a machine do that? And he said, well, no, a machine clearly can't do that because a machine doesn't have a body. And he is totally right about that. And Nick said, yes, you're right. But man, it can fake it really well. And part of the question here is how comfortable are we with this being a faking process as opposed to a authentic or genuine process? And if it's a faking process, but it's authentic to the machine, is that authentic enough? I don't know what the answer to that question is. I do know that this is going to get really interesting. And we're probably going to have other conversations about this in the future. If you made it this far and you haven't subscribed to the podcast yet, I would really appreciate it if you would take a moment and subscribe. You can also leave a rating and a hopefully positive review of the show wherever you get your podcast. That really helps us out. You can leave a comment on YouTube, a comment on Spotify. That helps as well. I hope that this episode really creates a lot of conversation in the comments. I'm very interested in people's take on this whole thing. Are you totally opposed to the idea of using AI in a mental health context? Are you totally opposed to AI in general? Are you an AI optimist? Would you love having a pretty good therapist just in your pocket all of the time? How do you feel about all of this? You can reach us at contact@beingwellpodcast.com. Really curious what kind of mail we're going to receive from this episode. And if you'd like to support the show in other ways, you can find us on Patreon. It's patreon.com/beingwell. And for just a couple of dollars a month, you can support the show and get a bunch of bonuses in return. Until next time, thanks so much for listening, and I'll talk to you soon.